Head and neck cancers include cancers originating from the throat, oral and nasal cavities. The more common head and neck cancers include cancers of the throat, tongue, tonsils and nose, also known as nasopharyngeal carcinoma. Treatment of head and neck cancers are complex and may include surgery, radiation, chemotherapy or a combination of different modalities. These treatments may potentially affect the function of the vocal cords, tongue and muscles of the throat. As a result, the treatment processes frequently cause changes to the patient's voice, speech and swallowing abilities, which affect the patient's quality of life and ability to function normally. Speech therapists collaborate with a doctor in addressing issues that are related to a patient's voice, speech, and swallowing functions. Surgery or radiation treatment may cause speech difficulties such as reduced speech clarity, a hypernasal voice, or a soft speech. Speech therapists will work with patients before, during and after treatment to better understand each of their conditions and provide the best form of therapy for them. Therapy may include educating patient of possible changes in voice and speech, establishing an alternative method of communication such as learning exercises to improve speech precision or use of a communication app. Swallowing is the process by which food or liquid passes from the mouth, through the throat and into the esophagus. During swallowing, the vocal cords oppose each other to prevent the food or liquid from getting into the lungs. Patients may experience difficulty in swallowing during and/or after head and neck cancer treatment. Some of the symptoms include dry mouth, gum and mouth sores, difficulty in chewing food, coughing during eating and drinking, food remains stuck in the mouth, food is stuck in the throat, food or liquid coming out through the nose, frequent chest infection due to food or liquid entering the lungs. If swallowing difficulty is left untreated, the patient may start avoiding eating and drinking, which can lead to malnutrition and dehydration. In serious cases, it can cause aspiration pneumonia and chronic lung disease. Speech therapists will evaluate the patient's swallowing abilities and help them with any difficulties they encounter. These may include texture modifications, such as the use of different thickness of liquids like nectar, honey, and pudding, and as well as different diet consistencies, for example, puree, minced, and chopped. Here are some advices to promote safe swallowing strategies during meal times. Appropriate sitting posture and ensure patient is alert. Avoid talking while eating or drinking. Use of recommended utensils to aid feeding. If the patient is unable to swallow safely despite these, the medical team will discuss with the patient regarding alternative feeding methods such as nasogastric feeding via a tube. A nasogastric tube carries nutritionally complete feed to the stomach through the nose. These feeds provide all the required nutrients, meeting all the patient's daily needs. It is crucial to seek professional consultation during the recovery process, as studies have shown that patients who receive speech and swallowing treatment earlier yield better outcomes in maintaining muscle structure and swallowing function. At CanHOPE, we customize treatment programs to suit individual needs and administer proper therapies to those who require help. For a more comprehensive treatment conducted by our trained therapists, call us at our hotline +65 6738 9333 or drop us an email at enquiry@canhope.org. You may also visit our website today at www.canhope.org.